Period pain has been so over-normalized in our society, and it doesn't help that if you go to your doctor, they really just don't have any solutions for you outside of maybe birth control. That's why today we're talking all about period pain, what is normal, what isn't normal, and what can you do about it? Because there are actually a lot of things that you can do to get to the root cause of period pain and heal it. And I am so honored to be joined by our new associate physician, Dr. Cecilia Cruz, who has a personal experience with endometriosis. She personally healed her own period pain and other endometriosis symptoms and is now helping other women do the same through a functional medicine and preventative lens. She's such an incredible asset. I'll mention it at the end of the episode as well. But if you listen to this and you want more help, I highly recommend booking a clarity call with Dr. Cruz, where you can meet her, talk about your own symptoms, and see what it would look like to work with her. Because again, she's truly an incredible doctor and such an incredible asset to anyone who needs her. All right, enjoy the episode. Dr. Cruz, thank you so much for being with me today.
Thank you for having me. I'm excited to be here.
Yeah. So before we jump in, I'd love to have the listener learn a little bit more about you and your background, if you can share that with us.
Yeah, absolutely. So my background is in functional medicine. I did my intern year in general surgery, and then transitioned from there to preventive medicine. I did my residency in preventive medicine at UCSD, um, and then got advanced functional medicine training, and that's really my passion and my main focus of practice now.
Awesome. What inspired you to go into preventive medicine and functional medicine?
Yeah, that's a great question. So, it's such an effective way to treat patients, but also it was a very personal story. So, um, I was diagnosed with endometriosis in residency, and at the time, I had access to all the best knowledge, a lot of great OB-GYNs, and I wasn't really getting answers. Everyone was telling me there was nothing that I could do about it, that we just had to monitor it, and that it would just get worse. And then maybe at some point I would have surgery because, there was really no intervention we could do before that. And then I came across functional medicine and I realized there was so much that we could do before you get to surgery or before it advances. So, really finding the root cause of disease, of symptoms now has become my main focus and passion.
Yeah, amazing. Well, that's one of the things, perfect segue into what we're talking about today. We really wanted to talk about period pain. One of the things we were talking about before was, how over-normalized period pain really is. And I was curious, like, what's your take on that? Why do you think maybe it's been so kind of glossed over in conventional medicine and over-normalized?
Yeah. I think that it's because the reality is that doctors are not getting a training on how to treat and deal with painful periods, right? We understand the symptoms, we understand maybe the pathology, but we don't really get trained on how to treat it. I think once we realize that it's a woman's having painful periods, our next resort is going to be an oral contraceptive pill to help manage the symptoms. Um, and so I think that plays a huge role. We're just not getting the training, unfortunately. Um, and so most doctors just normalize it and say, well, it's normal. Here's the pill to help you feel better and you move on, right? Uh, at most you might get an ultrasound, some very basic hormone labs, and if that's normal, that's where everything stops. But again, there's really so much that can be done and digged into to really figure out why you're having painful periods.
Yeah.
Uh,
Yeah, I completely agree. And I always like to remind people because I feel like it's such a frustrating experience for a woman to go to her doctor and really just be, feel sort of written off, even if it's not intentional. They're like, well, there's nothing we can do. Just go on birth control. I always like to remind people that the doctor cares. At least I truly believe that doctors want to help people, but like you said, they just don't have the tools to necessarily do that. And especially when we're, smart people, we don't want to feel, we're like, well, there's nothing you can do, rather than saying the truth, which is, I don't know. I don't know anything else that could help. Um, with that, I mean, maybe let's set the record straight right off the bat. What is actually normal then when it comes to a woman's experience during her menstrual cycle, during her period?
Yeah. So painful periods are definitely not normal. I think that's so important for women to understand. That is your body giving you signals that something is off or wrong and that you need to address. Um, and so normal really perhaps is having some mild cramping before your like a couple days before your period or the day of even. Um, Normal would be not even feeling any cramping and just having your period start. Maybe a little bit, some small changes in like energy or like you might notice, but very mild. It shouldn't be taking you out of work. It shouldn't be taking you out of school. You shouldn't, if you're planning exams or your work around your period, that's a huge red flag. Um, and so really, normal is just you have your normal life, and then around, day 28 to 32, you're gonna have your period start, and it shouldn't be painful. You shouldn't be really tired. You shouldn't have difficulty concentrating. All those things are not normal.
Yeah. Okay, great. And I love that you highlight that red flag of if it's taking you out of your daily life. It's like that's a really key factor to say, okay, how much is this really affecting me? I feel like sometimes we can get used to a certain symptom. We're like, that's just how my body is, maybe. But, if you are having to plan around that, that's a really big sign, maybe that something more is going on. And with that too, are there any other kind of like red flags to be watching out for or signs that are abnormal during someone's period?
Yeah, absolutely. And I think just to touch on what you just mentioned really quickly about you feel like that's just how your body is, right? You grow up this way. Oftentimes period pain starts at a young age or early 20s, or maybe since you started getting your periods. Um, and then the women probably around you, like how your mom, your sisters, right? They're probably going to normalize it as well. So everyone just thinks this is probably the norm, right?
Hmm.
But yeah, it's really important to understand that it's your body again trying to give you signals, right? That let's address something here. It might be inflammation, um, a variety of things, hormone imbalances, but not the norm. Other red flags to look out for. So really, if you're having like bloating. So a lot of women get a lot of bloating either throughout their cycle or at that time of the month. That's a huge red flag. Um, Pain with intercourse would be another one. Or if you're maybe spotting mid-cycle,
Hmm.
those would be maybe some of the more common ones. Some people if you're having more severe symptoms, some people might have vomiting or be bedridden, during that time of the month. So obviously that would be a huge red flag as well. But yeah, so those are other things to look out for.
Yeah, that's great. Yeah. And I feel like, even again, one of the things that I think of in my mind when I think of like the normalization of period pain is I had this commercial just like seared into my memory for some reason. I think it was for Pamprin. So that like it was like the, period pain medicine. And I remember just being like, oh, this is what you take when you have, period cramps. And again, to an extent, like you said, some cramping can be totally normal. It can be a little uncomfortable. But even just normalizing having to take medication for your period every month, like things like that, I feel like that just over normalizes it again. And so it's great to say, maybe that isn't totally normal. Maybe you shouldn't have to rely on that or some of the things you mentioned. I think that's great too. Highlight even like the spotting in between and things like that. I feel like it's so important to talk about because we don't talk about these things. And then, like you mentioned earlier, with your mom, your sister, maybe they're having the same period pain, and they're like, "Well, that's what I get. I don't know." No one knows really what's normal or not if we're not talking about it. So that's really great to highlight what's normal, what's not so normal, what to watch out for.
And women are great at dealing with pain, and I think that that's probably
Yeah.
part of the problem, right? That we're so good at it that we go through our lives, meeting our responsibilities, meeting our goals, dealing with very painful periods because we're we were raised that way. We were biologically able to tolerate high levels of pain. So that's another big factor, I think.
Yeah, I completely agree with you. And even beyond just pain, just discomfort of annoying symptoms, it really amazes me how long some women can go with really terrible symptoms and just, push through and get through, like continue to have a smile on their face. I mean, women are so strong. But yeah, a good reminder of, you don't have to be dealing with this. Yes, you are strong and you can deal with it, but you could actually just have very easeful menstrual cycles also.
Yeah. Yeah. And I actually, for me, I went through some of the worst period pain that I had was during medical school and residency because my stress levels were probably through the roof. Wasn't sleeping that great, all these lifestyle factors that were really impacting my cycle. And, I would be having pain 8 out of 10 sometimes.
Mm.
And yeah, show up for rotations and take care of other patients, right? And
Aw.
it's really it has made me realize, now being on the other side where, I've been able to heal my body with functional medicine and really finding the root cause and addressing it. And I think it has made me realize how much we can tolerate just based on my own experience too, right? And how you just show up and deal with that. And maybe you're taking a lot of ibuprofen, um, and then you just go about it.
Yeah. Yeah. Well, so, I mean, as horrible as it is, you've had to have that experience also. What an amazing gift that you can then relate to your patients going through it also and say, look, I've been there. I know. But then you can also be that proof on the other side to say, okay, it can absolutely change. With that, I mean, that will be the next place we go. But to get into sort of the why behind it, like why are some women having period pain? We already mentioned maybe endometriosis being a common cause. What are some of the like root causes behind period pain?
Yeah, yeah, that's important to know. There's so many, I mean, women's health is very complex. There's so many variables that could be a reason, right? A triggering cause. Um, Nowadays, oftentimes it's probably something related to inflammation, so increased inflammation in your body, maybe hormone imbalances. We know now through research that gut health really impacts pelvic inflammation, which then can lead, if you're having inflammation in your pelvis, you're going to likely have painful periods and it can lead to a variety of pathology. Um, so it could be something like dysbiosis or leaky gut. Um, those are probably what some of the more overlooked causes. And then, of course, if you have things like endometriosis, which unfortunately is actually like a very underdiagnosed condition,
Mhm.
so it can often be overlooked as well. Um, but there's increasing awareness around it, thankfully. That's another huge driver. Or fibroids, for example, can be another driver. So many reasons that you can be having painful periods, unfortunately.
Mhm. Yeah, it's such a shame to me. I mean, it just is what it is, but it's so hard for women with endometriosis to get that diagnosis, and for so long, oftentimes they have to be struggling with it before they find the answer. Yeah, and it's terrible. Luckily, I feel like there's better understanding about it. There are more practitioners who understand it and are able to, get to the bottom of it faster. But, I have a lot of patients too where their symptoms are just kind of sneaky too. It's like, well, it's not, full blatant, maybe really bad periods, but some fatigue, some digestive stuff that isn't clearing up otherwise, it can be so tricky.
Yeah, exactly.
Um, from there, so you kind of mentioned your experience, but can period pain be eliminated? Is that actually possible for women who are struggling with it?
Yeah, absolutely. And that's the great news and why, I mean, I am so passionate about this topic and so happy to be here talking about it. Um, Before I answer that question, though, I do want to go back really quick, because it can be sneaky symptoms. Going back to what you mentioned, I've had women tell me that they're having pain with bowel movements, for example, or they're having to massage their abdomen and only in order to have a full bowel movement. Those are red flags too. You could be having adhesions secondary to endometriosis, for example. So, um, other things, another big red flag to look out for that gets overlooked.
Yeah.
Yeah. Um, and then to go back to the question about can it be fixed? And yes, absolutely. So you want to look first, we look at what's really driving, right? The period pain. So we want to make sure that if there's pathology going on, so if there's a disease or a condition, right, like endometriosis or fibroids or a hormonal imbalance, that we're addressing that first. But diseases don't come in isolation. And this is why I love functional medicine because in order to treat, for example, endometriosis, you don't just treat endometriosis alone. You have to treat the whole body. So you have to treat the inflammatory condition that's maybe driving the endometriosis or the hormonal imbalance. You have to address lifestyle, things like stress. That is such a huge driver of period pain and um, you know, conditions worsening even. So we would make sure to address lifestyle factors, sleep, stress. Um, One of the lowest hanging fruit that you can really reach for is an anti-inflammatory diet. If you really try to increase your omega-3 intake compared to your omega-6s, that goes a long way in that inflammatory cascade. And really, what that means is having a predominantly plant-based diet that's really rich in color and fiber. So when I like to say that when you look down at your plate, you should be seeing 3 to 4 colors. If it's all one color, like you're missing something. And that's how you know you're getting all your nutrients and antioxidants. Other things, and a very easy, I think, also way to think of an anti-inflammatory diet is a Mediterranean diet. It's very accessible, very diverse. It's not very restrictive, and it's one of the more researched diets that we know is anti-inflammatory. You're getting a lot of colors and a lot of diversity in your food through that diet, so it's one of my favorite ones. And really minimizing animal products, right, which tends to kind of go more towards that omega-6 and minimizing dairy, minimizing meat intake. Um, so those would probably be some of the things that are easy, accessible, fast that you can do.
I love that. Yeah, the Mediterranean diet is really the champion when it comes to, any way of eating. And the word diet can sometimes be triggering to people, but it's just like a way of life, basically a way of eating, sort of a template. And yeah, you mentioned so lots of plants, lots of color, as much variety as you can get. And you mentioned omega-3s. Where are some great sources for omega-3s if people aren't aware?
Yeah. So my personal favorite is salmon. If it's
Mhm.
try to eat it 2 to 3 times a week. That is really high in omega, low in heavy metals, so
Mhm.
important. Um, if You can always supplement, which I do. It's just easy to reach, you wanna be getting around 2 grams per day.
Mhm.
So that with a supplement is really easy to reach. So I tend to supplement. Other sources of omegas would be things like walnuts, chia. That's my favorite. So I swapped out my oatmeal for a chia pudding in the morning for breakfast, and now I'm getting more fiber. I'm getting omegas, and about 7 grams of protein too, which I love. So, and it's low carb. So for women who are also struggling with like insulin resistance, it tends to be a great option.
Yeah, awesome. Yeah, and, I feel like it can get so complex with, like, the mercury conversation in the fish, but fatty fish, low mercury, like, look it up and, yeah, you can get some resources about why that is. But like you said, salmon's an easy go-to, for that to get more of the benefits, less of the downside of those. Well, amazing. Beyond that, I think diet is so foundational to our health. And like you mentioned, inflammation is a big driver of period pain. So absolutely, I feel like that's a must. What about beyond that? What other factors? Are there things, you mentioned maybe some supplementation, managing stress. If we're still struggling beyond that, is there kind of a next step that you suggest?
Yeah, absolutely. So if you've done all these things and you're still not seeing improvement, it's really important to partner with a good functional medicine provider that understands women's health because just like with anything in life, there's different skill level, there's different expertise, right? So you want to be when you go to your functional medicine doctor, you want to feel understood, you want to feel heard, um, because they'll really that'll really help you pinpoint the root cause of what's happening. So there's a lot of guessing that can happen when you're just basing it off of symptoms. And so working with a functional medicine provider can help you dive into testing, which then makes treatment a lot more targeted. I've heard a lot of women say, for example, I take supplements based on the symptoms that I'm having. And the thing is that symptoms can be misleading, they can overlap. And so by doing testing, we can know what's unbalanced or what we need to treat. And then really create protocols that are very targeted and personalized to you. So we're not using the same protocol that, you see online to treat you, because everyone's different, right? So that's the beauty also of functional medicine. It's very individualized. Um, and then once we start with a protocol, it might take tweaking it and changing it for you until we find what really works. So it is a lot of troubleshooting, but I think absolutely starting with testing, like I would start with gut health, right? Like how maybe do a gut test, see how that's going, hormonal panel to see how your hormones are doing, trying to really identify what's driving the period pain, and then coming up with very targeted interventions to help it.
I feel like it's such a trap that many of us go into of thinking, oh, I can just figure it out. I'm smart. I'm educated. I'm going to get all this information. I'm going to figure it out. And you're absolutely right. It can be such a trap to like go into each symptom. Think, okay, I'm going to get a supplement for this symptom. I'm going to get a supplement for this symptom. And really, we're missing this big picture of what's really going on underneath. And there could be actual healing that happens so that you don't have the symptoms anymore rather than just trying to cover them up with, a supplement. So I feel like that's so important to do that testing and really understand what is, because the same symptoms can be different in two different people, right? Or, different drivers, like you mentioned. So I feel like that's so important.
Yeah, and women end up frustrated. It's only to burnout if you're treating with, or you think you're treating with supplements and you're not getting better, right? It can lead to like supplement fatigue, pill fatigue. And just like with medications, supplements, you have to dose them correctly in order for them to be effective, right? And there's a lot of, I think sometimes because you can get them over the counter, you think, oh, I'll just pick it up and start taking it. But dose matters, timing matters. How you combine supplements matter. So, I think you definitely need someone with that background to help you navigate such a complex issue.
Yeah, what a great point. Yeah, supplements can also be dangerous. Not all supplements, but yeah, if you're not knowing how to dose them, how to put them together, yeah, that could be a big issue. Well, this has been so helpful. I think this is going to be I think this will give people so many highlights into what is normal, what isn't. Again, give them this avenue that they can take as another option for the woman who's listening and is like, okay, that's me. I need some extra help. What would it look like for them to maybe reach out and work with you in our practice?
Yes, absolutely. So right now, I'm really happy to be seeing patients through Modern Women's Wellness, and they can book a free clarity call with me to talk about their symptoms or see what it is working one-on-one with me. They can also find me directly on Instagram, and you can message me there. I'm at dr.cccruz. So there's various ways.
Yeah, perfect. And we'll link that in the show notes, both your Instagram handle and our website where they can book a clarity call with you. Well, thank you so much for being here. And again, I just want to say it's been such a pleasure having you as part of our practice. You are such a valuable asset to our patients, and I really appreciate you taking the time to share your knowledge here.
Absolutely. Thank you so much for having me. It's been great being here.